Hi everybody, this is Dr. Lamkin with Delta Foot and Ankle. I just wanted to talk to everybody today about a common condition that we treat here in the clinic, and that's plantar fasciitis. A lot of people have heard of this, or they hear of heel pain, although heel pain itself can be caused by numerous other things. But plantar fasciitis is by far the most common cause of heel pain. There's about 2 million visits annually in the US for the treatment of plantar fasciitis, so it's by far one of the most common things that we treat. The plantar fascia is the problem at hand. It's a ligament that runs on the bottom of your foot between the heel bone and the toes that helps hold the arch and prevent it from collapsing once you're weight bearing, running, walking, those kind of things. Another part of the issue that's often neglected is the Achilles tendon. Having a tight Achilles tendon, or what we call equinus, can affect the amount of pressure that gets put on the forefoot and thus stretching the plantar fascia. And when the plantar fascia gets stretched a little too much, you can develop micro tearing, and that's where the inflammatory cells come in. And with all the nerves that are entering into your foot from your leg, they don't like the new inflammatory cells that are taking up this space, and that's what's causing this excruciating pain that some patients have with plantar fasciitis. They've done studies that look at chronic plantar fasciitis, and the pathological studies have shown that inflammatory cells are not actually present over a certain amount of time of having plantar fasciitis, and it becomes more of a plantar fasciosis. And unfortunately, this is often neglected in the treatment of plantar fasciitis, as a lot of the common treatment, anti-inflammatories, steroids, those things are aimed at knocking out inflammation, which has been shown to not be present in some of the newer studies. So we take that into account when we treat plantar fasciitis. In an acute setting, in a new onset, steroids, anti-inflammatories are often effective, but over time, our goal is some of the less invasive modalities of treatment. Physical therapy works excellent. Stretching, we have certain stretching programs that can help you get back on your feet. Oftentimes changing your shoe gears, that's an important role that's often neglected. Having someone look at your shoes, determining what your activity is, wearing the right shoes, and then changing your shoes often enough based on your activity is important, and again, often neglected. I think everyone's heard of the surgical treatments for plantar fasciitis, but if you look at the studies, only 5% of patients with plantar fasciitis really need to have surgery. It shouldn't be common. It's not something that's needed, except for about 5% of the patients that just don't respond for whatever reason to all of the conservative treatment measures. And some of the issues with plantar fasciitis surgery can be seen later down the road, so we try to avoid it at all costs. But if you're struggling with plantar fasciitis, or if you ever had any issues with it, especially our running population, we see it in about 10% of them annually. Feel free to give us a call, follow us on social media, and we'd love to give you some insights and some help for how to get you back on your feet. So thanks.